know from the pandemic is that researchers and decision makers around the world teamed up very quickly and adapted very quickly to use evidence to respond to issues. But we also know is that there was a lack of coordination in doing that, and there was some imbalance in the types of evidence that was used. For example, at the start of the pandemic, we didn't need 12 groups around the world doing an evidence synthesis of how effective masks were. We needed one group to do one really good evidence synthesis, right. And the other teams could have been deployed to do any number of evidence syntheses.
For example, computer scientists or those working at tech companies are not at the forefront of their minds designing things to meet the needs of populations facing conditions of marginalization. They're mostly designing these things to sell to the average person, because that's the largest market out there. Now, there is no average person. That's one thing to debunk. But more importantly, if we really care about equity and health equity and ensuring that all members of our society can get through challenges like pandemics, we need to be thinking about and designing both the research as well as policies and interventions to make sure it's serving everybody's needs.
I think the buy-in has to come in from the community, and it has to be driven by the community, and that is critical for embedding health equity into COVID-19 planning, response, and recovery, because equity-informed responses can be amplified by tapping into not just researchers but also communities and community organizations.